Children all around the world experience the unfortunate and sad actions of abuse and neglect. The rising numbers of children experience child abuse and neglect are a problem that need to be focused on to provide solutions to decrease that number. Children with disabilities are a category of children who have an increased risk of experiencing that abuse and neglect. It is important, as for all children, to prevent these actions from occurring. After researching the rising problem of children with disabilities who experience abuse, I found in the article, Exploring Risk for Abuse of Children with Chronic Conditions of Disabilities by B. Svensson, U.B. Erickson, and S. Jansen, that children are experiencing this abuse due to parents lacking parental education and support for caring for their children who have those extra needs. Additionally, the parents are often feeling more angry towards their child due to their difficulties when handling situations. For an example, that child may refuse to cooperate when the parent asks them to go to the bathroom or clean up their toys. That child can become angry because they are not ready to do those actions, and then that parent can result in abuse towards the child. They can also begin to neglect care for their child as they do not know where to find resources and support to help care for the child who needs those special needs. In this specific article, these three authors conducted a study to help prove the problem associated with this topic of discussion. They conducted a structured, in-depth interview with 15 parents of those children who have disabilities. Each interview was anywhere from 30 minutes to an hour and was recorded 2 separate times. The first interview focused on the situation and the parents' perception and experiences of service and professional support to see if they were finding the resources to help channel their needs, help, and techniques of care for their child. The second interview focused on parenting, difficult situations in care, thoughts of physical abuse, and conflict strategies. During the interviews, every single parent indicated that at some point they had been too hard on their child, whether it was verbally or physically. Several parents stated that at one point they wanted to hit their child, and some stated that they had already have done so. A majority of the parents described that they had felt a high level of parental stress. Recommendations made to help minimize the occurring problem or interventions that focused on parental strategies to handle those high levels of parental stress. Another problem associated with the rising numbers of children with disabilities experiencing abuse of any sort is some of those children are unsure of what is appropriate and what is inappropriate. This could be because they are not exposed to the topic of sex, and parents and peers are not so open in discussing that topic with these children. Additionally, these children may have disabilities that interfere with their language development and cognitive development. Therefore, when abuse does occur to them, they may not be able to talk about it due to a lack of language or cognitive delay. They may also lack strategies to physically defend themselves, such as children who cannot use their arms or legs or may be paralyzed and may not be able to run away from situations. These types of situations may make the child remain quiet when telling a trusted adult that the abuse is occurring. In the article, an exploratory study of knowledge of personal safety skills among children with developmental disabilities and their parents by Hannah Miller, Catherine Pavlik, Min-Ah Kim, and Karen Rogers, they discuss a study that conducted to prove that this problem is another factor as to why children who have disabilities are experiencing abuse. In their study, they took a population of children and their parents who met the following criteria. The child was between 7 and 19 years of age, diagnosed with a developmental disability, learning disorder, communication disorder, and/or a biological or genetic condition that caused the developmental delay, and had a parent participating in the treatment. Parents had to demonstrate their literacy in either English or Spanish, and the child had to be able to sufficiently comprehend and meaningfully respond to interview questions. Interviews were conducted that asked questions referring to the child's knowledge of personal body safety. For each child participating, a parent completed a questionnaire assessing perceptions of the child's knowledge regarding puberty and physical development, and their ability to keep safe in situations. After conducting the interview, 10 children were able to provide more than one medical name for a private body part, while 17 children, the majority, were unable to provide any medically correct term for their body parts. Additionally, a large majority of the children were unable to describe physical changes associated with puberty. A very small number, only 5 children, were able to state at least one correct physical change, such as boobs grow bigger or a boy's voice gets deeper. Children also struggled identifying appropriate and inappropriate touch. Only 17 were able to correct what was appropriate and what was not, and 17 were not able to identify. Additionally, almost half of the participants were unable to describe an adaptive response, such as communicating no or telling an adult in situations of abuse. Furthermore, results of parents' perceptions of child abuse and their knowledge was also found. This varied as parents believe that their child is able to distinguish between the behaviors of what is okay and what is not, even though the numbers were not that high. A very low number of parents felt confident that their child could not always tell the difference of appropriate behaviors. In other words, parents had no faith that their child had proper strategies of keeping safe in situations of abuse. After researching the problem of children with disabilities experiencing the high risk of abuse and the effects associated with this problem, I was able to identify solutions to help prevent the rising numbers of children who suffer. A few solutions to keep these problems are by advertising more resources such as therapy groups to help children and their families reach out to other children and families experiencing the same circumstances. Parents can find resources to help them find strategies and techniques when working with their children. They can also find ways to channel their anger and aggression towards their child to prevent them from lashing out. By providing education and support groups for families, they can help decrease the rate of abuse. Additionally, as mentioned in the article, Evaluation of a Sexual Abuse Prevention Program for Children with Intellectual Disabilities by Yuri Kim, he found that by creating intervention in a prevention program, it can help increase knowledge and skills regarding appropriate and inappropriate behaviors in terms of sexual contact. A study was conducted to help prove if a prevention program decreased the likelihood of abuse occurring. Children were chosen for this study due to if they were in grades 4 through 6, diagnosed with a mild to moderate intellectual disability, insufficient verbal skills, and no prior training for children sexual abuse prevention programs. 3 Korean girls were chosen to engage in this study. In this study, they took visual materials such as posters, story cards, and coloring books to demonstrate examples of appropriate and inappropriate behaviors. They additionally utilized role-playing with the participants to see if they knew how to react in a real-life situation pertaining to circumstance of abuse. The results of the study proved that a prevention program did increase awareness of behaviors, and it was effective in minimizing abuse in children with disabilities. Before the training, participant 1 had a score of 0, indicating that she had agreed to sexual solicitations, and a score of 0 until role-playing was introduced. She then increased her score to 4, indicating that she reached an understanding of behaviors. Participant 2 also had scores of 0 during the beginning of the study. When role-playing was introduced, she also increased her scores. Lastly, participant 3 had an average score of 1, indicating that she sometimes could refuse sexual abuse, but she could refuse and then leave in an inappropriate situation, but did not always immediately report it, indicating that she may need a little bit longer of training to enforce the concept. Therefore, a prevention program is effective and a solution to the rising numbers of abuse in children with disabilities, as well as creating more resources and parental education for parents that are feeling powerless and emotional,